Stable housing is the linchpin for everything else. When we have stable housing, it's the foundation for all these other dimensions that impact quality of life. And when we try to do the other pieces, education or employment or physical health or mental health, without housing, our efforts become a house of cards that collapse. So housing first is so important. We have 54,000 households in Franklin County that are paying more than 50% of their monthly income for housing. And that's not sustainable. People cannot pay their rent on a regular basis if it requires more than half of their monthly income. And so we have to find the solutions as a community to do housing that is more affordable, making certain it remains decent and safe. It is, I believe, the single most important work we have to improve quality of life for people in our community. The public sector, the private sector, the philanthropic community is working with these cutting-edge nonprofits such as Homeport, who's been at the lead from the beginning, and the rest of us in partnership. We have figured out how to do financing, how to hold down costs, how to construct a better home that is energy efficient and that will last. We're really good at this, and that is Homeport's mission, and it's making a world of difference. There are two things, however, that we can't do as Homeport or Community Development for All People without an expanding commitment from the rest of the community. One part of it is it takes specialized financing for Homeport or for any of the other nonprofits to increase our scale. And we need to increase the scale because we have 54,000 households that are at extreme risk right now. We teamed up with CareSource to run a pilot where there are 10 pregnant women who were homeless or on the very verge of becoming homeless, and we moved them into rental units that we had developed. And they were very affordable units, but these women simply didn't have enough money to pay even those levels of rent. And so the CareSource Foundation came in and paid half of the rent for each of these families. Now, it mattered to do this because one of the reasons that we have such a crisis in infant mortality is that too many of our babies are born too small and too soon. And one of the things that causes babies to be born premature is there's too much stress in mom's life. Well, it's hard to imagine more stress for a pregnant woman than to be homeless herself and then worried every day about what kind of a world will her baby girl or boy be born into. So we got all 10 of these moms into 10 units of just really nice renovated housing here on the south side, and every one of those babies has been born now. And every one of those babies went full term. They were born healthy, and now those babies, one by one, are reaching their first birthday. And once you reach your first birthday, you cannot be an infant mortality statistic because the definition of infant mortality is a baby that was born, drew a breath, but did not thrive and live to their first year. And so this project it was a tiny little pilot, but it got the attention of a whole bunch of folks. And so it led the state of Ohio and the General Assembly to pass some legislation on infant mortality in general, but included funds for a pilot project to look at doing the same idea at a bigger scale. A project that'll serve 50 pregnant women with stable housing. And when that works, the real goal is to get to the point where our community says, no baby will be born in the shelter, no baby will be born in a vacant, blighted house. That every pregnant woman in this community will have a safe, decent place to live. And when we do that, we will have a significant impact in lowering infant mortality. I want to affirm, first of all, that Columbus is and has been a truly caring community. Secondly, we have the capacity, based on the work of groups like Homeport and others, to tackle and transform this housing crisis in our community. We can do this. We have the tools and the expertise. We have the methods to finance, to construct. We know how to do a lot of this. The challenge is for us to rally together and expand to a greater scale. We can build housing that is safe, decent for all of those households that are housing cost burden. It could be done. It can be done. I believe it must be done.